How you doing? How's it going? Things are great. Thanks for watching. Gonna go now. Just kidding. I'm just kidding. So, I bet you're liking my fancy headphones. Actually, I was just testing out the audio quality and realizing that there's some tricks on getting the microphone to work on webcams. Apparently there's a little issue when using outside microphones with Macs. And if anyone ever has any questions on how to make it work, just feel free to send me a message and I will help you out. Like that. Intensity. So much intensity. So yeah, one of the things I actually wanted to talk about, because I'm talking right now, you're just going to have to sit down and listen, is it's about changes, psychological changes that I've experienced, especially in the past couple of months. 2 months. And it seems to be such that I've had a little while now with hormone therapy. And everyone's just like, I know, I really appreciate the videos that people put out, like 1 week on hormone therapy, 2 weeks, 3 months. You know, that's so important to chronicleize that. I wanted to say chronicleize at first, but chronicle was the correct word. But I'm just going to say it the way that I want it. So, in any case, I'm definitely in a hand motion mood right now. One of the things that I've noticed now, having been on hormone therapy for the past, still doing hand things, for the past year, is that there's some deeper things that start to change that, like, you don't notice at the beginning because you're just like, well, I definitely feel different. My skin feels smooth. It really does. But besides all that stuff, there's some other changes besides calmness, besides changes in sexual drive, besides, you know, appetite and all these different things. You you honestly just enter a second round of puberty. And as you do so, one of the things to take into consideration are some of the deeper, more profound psychological changes that happen post your first year benchmark. And that's kind of what I want to talk about right now. Thanks for that long-winded, thanks to me for that long-winded introduction there. So one of the things I've noticed is that I'm incredibly, at times, forgetful. And I'm not sure if that's just because of work or because of just other things, not reading as much as I should be, or my age. But I'm realizing that, like, at times I'm just kind of forgetful. And as I've talked to doctors about this and read more articles, etc., I'm realizing that as I enter this second round of puberty, I'm also succumbing to the same things, the same conditions as one would experience in puberty. They're probably not as noticeable, because, like, when I think about my life when I was in puberty the first time, you know, if you ask me was I forgetful, I'd probably say I don't remember, honestly, because I was forgetful. But the changes were so gradual that there was no other basis for comparison other than my own self. And so since I didn't have that quest for knowledge back in the days, I wasn't really charting my memory and how well I can remember things long-term, short-term. But kind of kicking back a gear and rolling back, I know I'm finding myself like, oh wow, here is my memory, like, competency, like, from this time period, right before hormone therapy, and here I am afterwards. You know, I'm still just as sharp, I think, as before, but the thing that I'm realizing is that there are certain things I need to do to kind of nurture and take care of myself in terms of maintaining good memory. In terms of my definition for forgetfulness, it's mostly short-term forgetfulness. Like, my focus will be on one thing, and then it'll fraction into multiple things. And then suddenly I start traveling down all these different paths. But I know all the different paths that I'm taking down. But one of the things is I'm having trouble maintaining that focus on staying one until it's done, and then moving on to the next. My focus has definitely changed. So that's one of the other aspects of, like, forgetfulness that I'm talking about. That I kind of just divert every single time I find something else, like, ooh, that's shiny. I'll just start thinking in that direction. And so, I'm really doing my best through memory exercises and reading and writing to keep my focus channeled until something is mostly done, or until my attention is no longer required. But it has been challenging because I'll just drift off, and that's something that I'm not used to, is drifting off. And I'm not sure if that's specifically like within the realm of the female psyche, within the realm of my family, within the realm of my hereditary lines, within the realm of my life. You know, there's so many things to take into consideration. And hormone therapy itself is somewhat old, but not really at the same time. There hasn't been enough in terms of research for hormone therapy in regards to transitioning. While there is a lot in terms of birth control, it's not the same as when one is on hormone therapy, where the potency of dosages are a lot greater. And so I have found myself kind of just working at this level, and I hope I'm doing this in the right direction. This should be the left side, this should be the right side. This was before, and this is after. And kind of the way I was in terms of memory, like I would say that I was absolutely sharp. Given a particular moment, I could be like, okay, well, you were wearing this, that, your eyes look like this. I could count the number of buttons on your shirt. I could remember that level of acuity. Maybe that's abnormal, but that's just where I was. And then now it's more like that detail is gone. But my emotional intimacy, in terms of understanding that, I was always behind this veil, so to speak. Like I could observe and record things well. But it's much like, I don't know if any of you have seen videos of like robots. Like robots walking, and you're like, oh, look at that robot, that's walking, that's so cool. And those robots are looking at the information in front of them and thinking, okay, avoid that obstacle. It's all kind of programming in terms of responding to the world as if it was external. Whereas that's the way it was before, that's the way like it felt. There wasn't really a lot of emotional context. Now it's like, detail is going down. Down, down, down. But it's kind of leveling off now. It's like, I remember sort of how that, you know, what that person was wearing, the way the weather was, what day it was, what hour, what time. Things are kind of blurring. But what I do remember is like how a person's feeling, what their emotional context is, and kind of my other focuses are on how a person's doing. How is our relationship? How is our friendship? How are these things, you know, I'm thinking about this other person's psyche a lot more. There are other details that I'm focusing on. And so all of a sudden going from this robot that's kind of analyzing the world and being like, there's a set of steps, lift one leg, up another set of steps. Now I feel myself kind of moving in a way that I like, which is interesting, because it's like I can remember now the way people feel. And that's not to say that I was not empathetic beforehand. It's more like I was analyzing the data, and that's the thing, it was the way it was before. It was just like not having that kind of emotional attachment in terms of memory. So that's another thing. It's like a different format. Now, if I didn't confuse you enough already, I guess the best way to describe it was, in a past video, I was talking about how I was talking to one of my close friends, and she was like, do you remember the first time we met? And, you know, I'd been on hormone therapy for a while, and it took me a while to remember, and then I did. I remembered exactly. And then everything was different. The color scheme was different, the taste was different, the smell, the everything, the memory itself felt like it was in a different format. It was like VHS and like DVD, or like it was 44.1 kilohertz to another format. Like, yes, they could kind of translate, but where they went to different places. And so when I remembered those memories that had been kind of buried deep in like long-term memory, I was like, oh wow, this feels like a different person, like remembering these experiences. It feels like yes, they are my own, like I don't feel any detachment, but when I pick up these memories and then like look at them and analyze them, it's like I not only remember the memories, but I also remember the way that I remembered things. And it was so different. And I'm like, oh, yeah, now I remember the way things were before. And the interesting thing was rolling back from the beginning of, to the beginning of hormone therapy. It's kind of like I was on this divide. And I was kind of like just going back and forth, trying to get out of this precipice, essentially. Rolling back and forth, and kind of just in this well, where I could remember one way and remember the other way. And it was really interesting. And I had a definite spot that I wanted to go to. I wanted to be on this side, having left this side, but the problem was falling in. I was stuck in between. And so it was interesting kind of remembering old things and being like, oh, this is the way it used to be. And now rolling back to the present where like things are remembered in a different way. And so the things I remember are different. But based on the standards with which I used to remember things, I feel like I'm becoming a lot more forgetful. And I think that's okay. I from what I understand of it at the moment, it's kind of in the phase of puberty round 2. And I'm kind of like also very childish too. I've had like these like whimsical tendencies on top of already having whimsical tendencies. So it's like, it's squared essentially. And so I find myself being a lot more goofy than I have been. But then also that's a lot to do with the fact that I feel a lot happier. But it's so interesting. It's so interesting seeing like how I've passed this little trench and then kind of climbed back up with enough momentum, and now I'm just kind of rolling along, and you can't see that. This is what was happening. That was what was happening. And so I'm really happy with results right now. But at the same time, I'm like, I'm a little scared, because it's like, if someone told you exactly a little more detail on like the nitty-gritty of like your memory. Like memory is like such a fundamental part of our essence of who we are as human beings. Memory. It's like you forget everything, then you don't have the knowledge you have to do the things you do. You lose your knowledge of people. You lose your knowledge of yourself, of your tastes, of your interests. Memory is essentially like yourself. It's like the past, but carried in the present, and still living. And so in that paradoxical sense, it's like, it's very much you at every moment that you've been you. And to lose some of that, or for it to be altered, is such a mindfuck. Pardon the language there. Swear a little bit. A little swearage. Sorry about that. But honestly, I'm going to say it again since I've crossed the boundaries there. A little bit of a mindfuck. And so I was really worried. I was just like, oh my god, am I forgetting everything? Like, and for a while, I realized like I was forgetting my keys. So I forgot my debit card. I forgot my license. I forgot this and I forgot that. And I'm realizing that I used to operate with stress in a whole lot of a different way. I used to be able to just be like, yeah, give me stress. Come on, give me some of that stress. I can take it. And still remember things well. But once that stress was cut off, I'd be like, oh, I can't do anything. But now it's just like, it's kind of a reversal. Whereas, I know when I'm stressed out. I know that when I'm stressed out, I have trouble remembering. And so, to kind of work with my new configuration of myself, it's just like, and it's a very valid one, it's a very new one, it's one that probably applies to a lot more people, is that, okay, so in case I forget my keys, I'll just put it in the same spot with my debit card and my credit card and set it on the bookshelf and put it there every single time so that I don't set myself up for failure. And that seems to be the trick, is just to not set myself up. And so learning how to be with me again has been so interesting. And so that's some food for thought. Comments, suggestions, ideas, feel free to post them down below. Comments, questions, ideas, etc. I'm happy to reply to them. And thank you so much for watching. And I'm going to stop this video before I forget how long it's been running for. Thanks for watching. Stay cool.